Today on the show, we have a lot of important conversations to have, and mostly surrounding something that's become more of a topic of regular conversation among the people here in Oakland County and all over the United States and the world over the course of the pandemic, as we have, and I'll just make a little bit of an adjustment here, as we have seen a lot of people really look inward over the course of the pandemic and realize some of their own anxieties and their own issues with mental health that they previously maybe have not addressed and have been more adamant about addressing now after and during the COVID-19 pandemic. And to talk more about that, we are pleased to be joined by our first guest today, Dr. Brooke Weingarden. She joins us from the Birmingham Maple Clinic here on the Oakland County Megacast. Dr. Weingarden, thank you for being with us today.
Hi, thank you for having me. Good morning.
Good morning. Good to talk to you. Good to talk to you. How are you, and how's the team over at the Birmingham Maple Clinic?
We've been doing great, although we've probably been the busiest. I could speak for myself. I've been the busiest that I've ever been in my whole career over the last, year plus.
Yeah, I can only imagine. And even now, as I've said while introducing this interview today, that we've seen more people over the course of the pandemic look inward and be more vulnerable about talking about some of their issues with mental health or how they're feeling about their mental health, maybe as a result of being cooped up at home or the added stresses of the pandemic, whether that be financial, whether that be based on their work or their family life, or just being stuck at home and the way of life that they are used to no longer being present there. But now we're starting to see society reopen itself. Of course, restrictions across the state of Michigan were mostly lifted yesterday for a lot of businesses and other recreational places. And now we're starting to go back to normal. But for a lot of people, it's not going to be that easy and that flick of a switch to go back to normal. It's going to be a big adjustment for people, isn't it?
Absolutely, absolutely. I feel like this has been something that I've been talking with patients about quite a bit within recent. There are certainly people that are ready to go in full force out to the world, and there's quite a few people that feel a sense of dread and doom and feel as if it's wrong to go out, or it's still sort of scary or unsafe. A lot of increase in social anxieties. A lot of, what we would call agoraphobia, fear of being out in public, even stepping outside of the house, or, the quiet of the little bubble that we've been in our safe zone has suddenly become very overstimulating and overwhelming, and people are really struggling to reemerge.
And so that's something similar to, and on our notes here we have, that one of your areas of expertise is in addressing and treating post-traumatic stress disorder. And that's something that a lot of people would confuse as being, because they hear about that a lot when you talk about veterans, when you talk about people that have been in traumatic situations overseas at war or in violent situations maybe at home. And so but it's not necessarily the case. Post-traumatic stress disorder is something that can occur in anybody. And what are some common areas in regular life that we see this disorder be triggered in some people?
So yes, it's absolutely true that we can certainly see post-traumatic stress in some of these very severe traumatic events in life, but traumas can occur in many areas, even in people that are not in war, and people that are not in such severe situations. While those are certainly the more common that we think of when you say post-traumatic stress, we actually see it in many different situations. The disorder can be in any kind of overwhelming, terrifying, or traumatic event, and that is very subjective to the person. PTSD itself is a classification of trauma and stress-related disorders that develop when a person themselves experience threats of death or injury, either to themselves or to somebody close to them, when they're exposed to vivid details of a traumatic event. And especially this year, we've really been exposed to quite a bit of, people who have gone through, such traumatic experience, with COVID, having COVID, fear of COVID, financial fears, certainly people who have been in quarantine in domestic violence situations or hunger situations, any kind of situation that is so highly stressful or traumatic, and seeing others in those situations can really trigger a post-traumatic experience.
And these situations, a lot of the times, when we're speaking about, in the context of COVID-19, but really even before that, these are not necessarily new situations. Some of these were just exacerbated by the pandemic itself. So how do we as a society, as we're coming out of the pandemic and we kind of try to put COVID-19 behind us and in some ways forget about it without necessarily ever really truly forgetting about it, how do we address these issues that may have already been in place before the pandemic, while also taking into account that COVID-19 is also going to have had a major impact on these people?
Right, absolutely. And there certainly are people who have had traumatic experiences within their lives, and this experience has been a major trigger, and then those where this experience themselves has become their trauma. And I think, something that I really enforce with my patients, first of all, is baby steps. We have all been through this, relatively traumatic situation for ourselves and for our families and the world, really. And it's important to not be so hard on ourselves as we're trying to reemerge. There's going to be a lot of people that can't just jump out into the world and have everything be exactly as it was, because nothing is exactly as it was. So, taking it easy, baby steps to reemerge, sort of doing little bits at a time. And for some people that would be enough. And for other people, when they're really this triggered, having a little extra support and knowing that it's time to call a psychiatrist, a psychologist, to get a little bit of extra care and support is going to be very important, because sometimes our brains are able to deal with certain things and move forward, and sometimes it really does need a little bit of extra care in order to process and move forward.
Dr. Brooke Weingarden with us on the MegaCast. She is from the Birmingham Maple Clinic. And Dr. Weingarden, when is it time to make that call, or time to consider making that call to a professional like yourself, others at the Birmingham Maple Clinic, or other medical and psychological facilities across our local area?
So that's a great question. I think it's really important to look at the overall functioning. If you are noticing that you are not sleeping and you are not eating the way that you normally would, you're not as interested in engaging with your friends or your family, you might be isolating more, you're starting to have flashbacks of some of the traumatic experiences or nightmares that are keeping you up, avoiding different situations or topics that bring up these triggers, or starting to just feel overall negative about yourself, the world, feeling shame or guilt, any of these kinds of changes that really would be affecting your overall functioning, those are major symptoms of PTSD. And when it's interfering with your daily life, then that's really time to say, I think it's time for a little extra, intervention and help.
So on the topic of treating PTSD and other anxieties, just as we continue the conversation about mental health as a whole, which has a huge spotlight, especially in the past year and a half, how do you know if you are seeking help, you're seeing therapy, how do you know if that therapist isn't necessarily working for you? Because not every therapist is the right fit for every person. So just because you're seeking therapy doesn't necessarily mean they're going to fix all your problems. You go to a few sessions or whatever. At what point do you think you can maybe scratch your head and say, maybe I need to see someone else. Maybe this isn't a great fit for what I'm dealing with? So
that's such an important thing to emphasize. And I like to have this conversation with patients all the time. You're absolutely right. Not every, there could be an amazing therapist and it's not right for a particular patient. If somebody, it's a lot about clicking and about the fit and about making sure that you feel comfortable and that it's somebody that you feel like you can speak with. And if you don't feel comfortable, if you don't feel like you're able to connect, then you may not get as far with your treatment. Certainly therapy is a process, and it's not going to be just a couple of sessions and everything's going to be better, because that's not the way it works. You come with a lifetime worth of things that you are trying to process or even a very significant event. Of course, a couple of times is not going to make or break it. But if you're not feeling comfortable and if you're not feeling connected, then it may not be the right fit. And it's not offensive to anybody. You have to feel like you're comfortable, and you have to feel like this is a situation that you can work with. Some of the very best therapists, with some of my very best patients, it just may not be the right fit. So you have to find somebody, and sometimes it takes a couple of tries, but once you do, it makes a world of difference.
Yeah, absolutely. And do you think it's the obligation of the therapist or of the patient to be the one to recognize, hey, maybe this isn't a great fit for me? Are there situations where the therapist is the one to say, I don't know if I can help this person, even if they realize, even knowing that, of course, they're experienced, they've helped a ton of people, but they realize that someone's situation is out of their hands? Do they have an obligation to step up and say that they can't work with someone anymore?
Well, absolutely. I think that it comes from all angles, and certainly some patients are more or less comfortable saying that to a treating physician or a treating therapist or whoever they're working with. They may not be comfortable bringing that up, and if they are, that's really helpful. And I always encourage my patients to speak with their therapist, and if there's something that's not right, to let them know. But a therapist or a physician or whomever you're working with, even if we're not feeling that the connection's there, if we don't feel like it's the right fit, there are many times where we might say, I think that I might not be the right person for you. This seems like it may not be the right fit. Let me give you some other referrals of someone that might be a better fit or might address your specific concerns in a better way for you. And that's not, there's no hard feelings. And that's important to emphasize, because I know patients are often afraid to bring things like that up. We also want patients and clients to feel better. We want to make things better. And if it's not the right thing, then that becomes a barrier. And so if we can guide someone to a better situation, then that's okay too.
Yeah, you're ultimately working as a team to try to create the best possible life situation for your patient, and your patient, of course, is working on that end too, to create the best life situation for themselves. We're joined by Brooke Weingarten from the Birmingham Maple Clinic here on the Oakland County Megacast. And Dr. Weingarten, to go back to the post-traumatic stress disorder treatment, is Post-Traumatic Stress Disorder Awareness Month here during the month of June. And when people are going to get these treatments and they're going to start seeking therapy or seeking treatment for some of their mental health issues or concerns, maybe one of the things that's at top of mind is that maybe delaying them getting such treatment is thinking about, well, I don't know how this is going to go. I don't know what the process is going to be like, what some of these treatments are like, and maybe there's some anxiety that comes with that as well. In the case of post-traumatic stress disorder, what are some of the common ways that is treated?
So there are a couple of main ways that PTSD is addressed. On my perspective, from my side, I'm the physician, and so I work medically with many of these patients, and there certainly are medications that are approved and that can be very helpful to patients in either helping symptomatically with sleep and with some of the nightmares and the mood. But then looking at therapy, there are also specific ways, whether it's supportive or, cognitive behavioral. But one of the biggest and one of the most common main forms of treatment for PTSD is Emdr, which is eye movement desensitization reprocessing. And that's something that we even recently heard about in Prince Harry's interview about processing with his mother's tragic death and his own PTSD. EMDR is recognized by the World Health Association and the U.S. Department of Defense as one of the primary treatments of trauma that, aside from medication management.
So when people are looking out for symptoms of post-traumatic stress or other mental health issues, but specifically post-traumatic stress disorder, what should individuals or friends, family, coworkers, etc., be looking out for in individuals that may be suffering from this?
So again, some of the main symptoms of post-traumatic stress include what we would call intrusions, nightmares, flashbacks, which are unwanted, upsetting memories of the event, avoidance of thoughts or feelings, places, or people that might remind them of the event, changes in physical and emotional reactions, which is, difficulty concentrating, sleep issues, irritability, sometimes even aggression, negative changes in thought process and mood. So feelings of negativity about oneself, of the world, feeling shame, sometimes difficulty recalling even parts of the event, so suppression, depersonalization, meaning that the world around you feels like it's not real. You're sort of watching things from the outside in.
Dr. Brooke Weingarden joining us on the Oakland County Megacast. She is from the Birmingham Maple Clinic today, speaking with us about post-traumatic stress disorder. June is Post-Traumatic Stress Disorder Awareness Month. And Dr. Weingarten, we spoke about some of the symptoms to look out for in terms of treatment and in terms of how long it really takes to see some results, or maybe even be in recovery from a disorder such as post-traumatic stress. What's usually the timeline before patients, and of course it's going to be individual to each person, before patients are seeing some results from their treatments?
It really is very individual, and it depends on a number of different factors. If we're looking at medications, it depends. Sometimes the first thing that we try is wonderful and helpful, and that's very exciting for us. Sometimes it's not the right one, and the body just doesn't respond to that, and we have to consider other options, and it's a little more of a journey. Sometimes a medication can take the edge off so that you can then work in therapy. It's a little bit like a roller coaster, though. You'll see ups and downs where there are times where there are things that feel better, and then there may be times where there are flare-ups, just like you would with any other medical diagnosis. It's really hard to put a very specific timeline because it depends on the brain's healing process, and it depends on, how quickly. Just like when somebody has a cut, some people heal a little quicker than others. And obviously this is much more significant, but using things like EMDR certainly help to, quicken and facilitate that processing so that, the memory of the traumatic event doesn't cause the same distressing symptoms as they were.
So what exactly is EMDR? Can you explain that to us a little bit more?
Sure. So EMDR, again, eye movement desensitization reprocessing, one of the main forms of treatment for post-traumatic stress. And it's conducted by bringing the specific traumatic memory to the patient's mind and then having them focus on the painful memory. Then the clinician, the therapist, will then use bilateral stimulation to help the brain process the material in a different kind of more adaptive way. And when I say bilateral stimulation, it is moving back and forth across the midline of the body. And so sometimes that can be watching a light, hearing sounds. When we talked about Prince Harry, when he was explaining EMDR in his Oprah interview, he mentioned using tapping with his own hands on his shoulders as bilateral stimulation, so on both sides of his body, and that helps with the processing. So nothing hurts, nothing is scary about it, except that you're sort of bringing up obviously the traumatic event and topic. And so sometimes it is a process because patients and clients can often only do little bits at a time because it's certainly, this is a major traumatic thing that they're working on. During a session, a patient or client will then focus on the traumatic event. They're going to think about what was seen, what was felt, what was heard, all of the different senses during the event, any specific beliefs and body sensations about the event. And then the therapist will engage this client in bilateral stimulation, as I had mentioned. And then the patient's role is to let whatever comes to mind be there without any kind of judgment or controlling it. So it's sort of just whatever stream of consciousness comes out. And then the goal of the EMDR is to reduce sort of that intrusive nature and the emotional intensity of the traumatic memories and develop more positive thoughts and beliefs about that traumatic event. A lot of people might ask, what does that feel like? Does it hurt? Is it scary? It's very similar to to REM sleep, when you're asleep. So that rapid eye movement where you look at somebody and you see their eyes moving back and forth. Have you ever gone to bed upset, you've gotten a full night's rest, and you've woken up feeling better about the, negative experiences of the day? So, that's kind of the brain reset, and that's sort of what the feeling and experiences would be with EMDR.
Dr. Brooke Weingarten with us on the Oakland County Megacast, joining us from the Birmingham Maple Clinic. Dr. Weingarten, just another couple minutes with you. If people want to find out more information about post-traumatic stress disorder or seek some treatment from the Birmingham Maple Clinic, how can they get in contact with you?
So the Birmingham Maple Clinic, we have a website. It's birminghammaple.com. And we actually have a lot of resources on the website, including, resources to look more into EMDR, looking up the EMDR International Association website. But we also have all of the physicians and therapists listed on there, all of our specialties, our contact information, and we have many different therapists that treat post-traumatic stress and anxiety, and there's a few of us that are physicians there as well that are there for addressing these very similar things medically.
Well, Dr. Weingarten, we thank you very much for joining us on today's show.
Thanks so much for having me.